Welcome to Functionally Speaking, the podcast where two clinicians share one brain cell and way too many opinions.
I'm Laura, your mineral-obsessed dietitian who gets fired up about gut health, metabolism, and fertility, with enough sass to keep it interesting and enough nuance to keep it real.
And I'm Danielle, a physician assistant obsessed with gut health, hormones, and calling out bullshit.
We're here for the nuance, the hot takes, the facts your certification skipped over, and the occasional spiral into chaos.
If you're a health coach, practitioner, or clinician who's slightly functional, just like our mitochondria in our recording process, you're in the right place.
We're not here to sugarcoat the science or pretend there's one right way to do this work. We're doing it our way, unfiltered, slightly feral, and always with love for the humans we serve. Let's get into it.
Welcome back for another episode of Functionally Speaking, the clinical pod that spirals responsibly.
We try.
Listen, we make no promises. We make absolutely zero promises, but I'm excited to talk about this because I've done a couple of posts on these things, on the topic that we're going to talk about, like red flags, green flags of practitioners, PCPs, whatever, like however you guys want to, clinicians at large, right? And I think that this is such a good conversation because I get this question a lot from people. And my first response is always like, hi, you're already following me. You've slid into my DMs asking this question, ma'am. But I think, for people who want people in person or they need a prescriber and they're seeing a dietitian or whatever the case is, I have we have red lights, green lights, and then like questions to ask. So we want to start with red lights?
Let's start with the red lights. Like what? The red lights? Yeah. The red flags.
Yeah. Red light, green light, red light.
We were just playing red light, green light on my son's soccer team. So yeah, this is more like what we don't want to see, right? Or like if you see it, it should be that red light, red flag for you to say, right? Like not, I think like one red flag is not a reason to completely dismiss a practitioner, but I think it's enough for you to start having some discernment of like, that doesn't really sit right, or that likely isn't going to get me the outcome that I desire or the relationship that I need. And that's really what we want to give you here. If not like, if they have all these red flags, please run. But like, if they have mostly green flags and there's like one or two and they're open to a conversation, I think that I also feel like I want to be fair in that respect too.
You're so kind. I'm not.
Well, I think there's some that are like absolutely no-goes and some like if they're outside
it depends
their scope,
on what
like,
the red flag is, right?
Yeah, so
like
let's start with some.
Yeah. I would say my first one would be they're saying no for no good reason to reasonable tests that you want to run about your health. So you would like a vitamin D level, you would like a fasting insulin, you would like a daily a full thyroid panel. These are tests that we know. The information coming out about vitamin D is actually quite mind-blowing to me about reduction in risk of colon cancer, breast cancer, fibroids, depression, anxiety, gut health, immune system. Yet we have practitioners out there going, tell your dietitian that this has not been part of the USPTF standards for some time, and she should know that. I'm glad that you have
stories.
That
happened to me.
That did not come just out of nowhere. Like
no.
This actually happened. And it's like, great. All you said to me is that you have no ability to critical think and you are just downloading things that institutions with 3 letters are telling you to do.
Not to mention,
I take a big problem with that.
In one sense, I once asked, I think, Jamie, I'm like, why do a lot of providers decline testing? I try to see a 360 view of like, okay, what am I missing? And she said one of the reasons is insurance, right? They know it won't cover it. So as a, either if you're a clinician listening or just a, human being listening who goes to a clinician, understanding that like, okay, insurance might not cover it. And there are plenty of ways to get it either covered or at a lower cost, or if you're willing to pay out of pocket, you can do so. So that's one. And then the other thing that Janie said is that a lot of providers, also shout out Janie, she's probably listening. Thanks for this. She said a lot of providers don't feel comfortable or confident interpreting the labs. And so a lot of times they won't order it because of that. So I think that could be like a maybe orange flag of like things that they should be able to interpret, like a vitamin D or a fasting insulin. Like these are things that I've heard. It's like, oh, I don't test that.
Which is so sad.
It is. And it is unfortunate because they are very essential in preventative wellness and medicine, right? Like understanding the vitamin D is preventative in so many different avenues of health. Fasting insulin, we know for metabolic dysfunction,
Ugh.
metabolic syndrome, like it is imperative to look at that before we're looking at A1C. And so for a provider that, and asking these questions can be helpful of like, is there a reason that you won't order this test? And if they have, they say nothing, well, then that's a red flag. If they say
Yeah.
insurance, you can say, okay, well, I'm willing to pay out of pocket or willing to find other ways to pay for it. Most people can now go to LabCorp request and get tested. There's,
Fasting insulin, by the way, I would just like to say through Rupa Health is a $10 test.
they're all
Vitamin
so cheap.
vitamin D is a $20 test. It's the cost when you go out of pocket to do these things, I guarantee you
Cheaper than
is
insurance
so
coverage.
much cheaper than trying
It
to go
is.
through your insurance. And there's the guesswork is like completely out of it, right? You're not like, oh, what bill am I gonna get slapped with in 6 months? Like,
Yeah.
And to me, these things are just, we know, again, like fasting insulin, right? We know that it detects metabolic dysfunction with your glucose 10 to 15 years in advance. And yet these practitioners they're so hellbound in some instances of, oh, someone online told you that you need this. It's so dismissed because it wasn't their idea. And I've seen this a lot. There's, a lot of poo-pooing about, well, oh, you read that on the internet kind of attitude with when you go to see your PCP or endocrinologist or whoever in person. That to me is a huge red flag to run. Like,
Yeah. And I feel like that
that's
is
so
in
ego driven.
general. Yeah. And like kind of like being dismissive, right? Or invalidating of the person, right? Like I think we also have a population of people, or at least I know I do. I'm not going to speak for you, but I can probably, but most of my clients look healthy, right?
Yeah.
Like most of them would go to their doctor and based on the rest of the population, they look and seem
Oh,
healthy.
yes.
And so they get dismissed when they say, I'm tired, right? Oh, you just need to sleep more. My joints hurt. Okay, yeah, you need to lose weight, right? There's always like something of like, no, it's all in your head. You're perimenopausal, you're postpartum, right? There's always kind of an excuse. And if you have a provider who's constantly dismissing and constantly invalidating, that's a huge red flag because it's one thing for them to not have understand and just say like, I don't know, right? I'd rather a
Yeah.
provider tell me I don't know
100%.
than
Green
tell
flag.
me, yes, that's a
Green flag.
yes, yes. Like I'd rather
Honestly.
them say that and like, hey, we probably need to pull someone else in here than someone who's like, you're just tired. You're just a mom. You're just perimenopausal. You're just like that dismissiveness is a huge red flag to me because you are the only person, and whether you're a clinician or not, who's ever going to be in your body. So you are the only person who knows how you feel and how things have changed. And that's how I always talk to my clients. It's like you have to be your biggest advocate and you need a provider who's going to trust that what you're saying is real and be on your team, as opposed to saying, like, oh, you're just a mom, you're just tired, whatever. Like that feels awful. Like think of anytime someone's dismissed your feelings, right? It feels awful.
Yeah. Yeah. That's a big red flag for me. And for the clinicians listening, I do want to say like this, there are limitations to this too, right? Like if you have a headache and you come in and you ask for an MRI, like that's a little,
Yes.
that's an excessive use of resources also, because it always blew my mind when people were like just ordering all this imaging all the time. And I'm like, okay, we're missing some steps here. Like I remember one of the physicians that worked in the group that I was in last, there was this woman she literally had, I think it was like 15 CTs of her abdomen in the past year. And like the doctor in my group tried to tell the ER, like, stop imaging her. Like, this is excessive, because those are resources and that does affect all of us and what we pay for insurance, and not that one person, but like when you have excessive use of resources like that. So that is not what we are talking about. And so I want to be clear about that. We're talking about very basic,
That also to
necessary
me is
things.
like, why are the providers not like, why is that their only solution, right? Like, why is imaging or that their only solution, right? Like, we've both talked about like the client who's drinking less than 40 ounces of water a day.
Right.
And like, yeah, they're having fatigue and headaches. And it's like, did anybody ever ask them about the basics? And I think that's a red flag for me is it's kind of like this catch 22 because like I don't want the doctor who doesn't have nutrition education to be giving nutrition education, but I also want them to be screening for the basics and asking the right questions instead of, I've overheard in my doctor's office many a time them preaching the Mediterranean diet, but they've never asked the client or the patient what they're doing.
Yeah. Like,
Like, do
what's
you
your
even know?
activity level?
Right. What's your activity level? What are you hydrating? What's your sleep like? What's your stress? Are you going to therapy? Like, are we getting you? Do you need a dietitian? Do you need a physical therapist? Do you need a therapist? Right.
Yeah,
Like
like
that's what they
even
should
if
be
we're not
screening for.
giving nutrition advice, right? Because doctors, this is actually one of my red flags. Like they're giving nutrition advice, like quit eating bananas or protein hurts your kidneys with the 0 to 2 hours of nutrition education that they received, which like I personally think that there should be an entire semester of in medical education about diet and lifestyle because it is the first line treatment for literally every single chronic disease. So even if they're not treating it, we need to have some awareness. In my opinion, I've long said this. And also, even just asking someone, hey, like, do you feel like you need some support with nutrition? Like, I can get you referred to a dietitian, or, having those, like, shout out to the collaborative. So, like, having those connections with strength and conditioning coaches, or knowing who you can refer people to for exercise or nutrition or gut problems or airway, like whatever their problems are, right? Like asking those questions, even in the very most basic way. I went deep with people on this stuff. Obviously, when I worked as a PCP, I recognize that not everyone can do that. Not every doctor, practitioner, whatever, but the basics, please, my God, like it just,
Well, and I think it's like I try to have some empathy and understand that like your time is so limited as a provider, but I think we can get the basics. We don't have they don't- you, like the provider doesn't need to be the primary nutrition educator, but
right.
they should be the primary screener, right? Of
Yes.
like understanding of like you don't need to recommend the Mediterranean diet. You need to say, okay, what are they doing, right? Like having the right questions and then referring. What I've seen be a problem too is that a lot of these providers don't know where to refer. So I think being a provider who has a solid referral network is a huge green flag. Obviously, we're
Yeah.
biased because we're in this collaborative and it's wonderful. But I also hope that they would refer and say, I might not know. But now there's, not that I'm a huge fan, which could be a whole nother episode of like the Nourish, and there's a bunch of those like online dietitian programs now.
Mm.
But even starting there, right? Like would be better than them being told eat the Mediterranean diet.
Or don't eat bananas.
Right, or kidneys are gonna hurt your
Kidneys are going to hurt your protein.
Oh.
Oh boy.
Oh boy.
Okay.
Okay, anyway.
We're thriving. Other things that I had written down were that most of it's interesting. I just said this recently. I started my business at a very interesting time. I think I was 37 when my LLC actually first formed. And now being 41, I went from like people with period problems, like much more into the perimenopause and metabolic health space, like kind of quickly. So if your practitioner still thinks that estrogen causes breast cancer, like that's a huge run for me. If you go in to have a conversation about HRT and your practitioner is like, that causes breast cancer, I would literally get up and walk out mid-appointment. Now, I am bold and I don't take no shit, but this is just not true. We have so many studies that are rebuting this. This study is the WHI trial, which did have some decent findings, but it was very, very confounded. I'm not going to go into all of that. We should. If people want information on it now, I would point them to the episode that Rachel Rubin did with Peter Attia. In my opinion, it's the most important podcast episode that women in their 35 to 50 age range can listen to this year. Like 100%. It was so valuable.
We'll make sure it gets in the show notes.
Yeah, Jill, if you can, our podcast human who's listening, she's probably like, what the hell? If you need it, let us know. But if you can find it, it's definitely super valuable. But this is a scary thing to me that people still have this mentality. And
well, I think that, some of the overarching like theme there too is this like fear-based type
and
provider.
also, when was the last time you read research? Like you're not keeping
Right.
up with shit
No,
if you still
they
believe
aren't,
this.
which is hard. I think another thing kind of similar to that is if your provider jumps straight to GLP-1s, which if you want our opinion on GLP-1s, we did a whole episode on it. We're not for or against.
Yeah.
But I can't tell you how many of my clients have gone in for a routine OBGYN appointment or a routine physical and are offered a GLP-1 without ever being asked, do you even want this? Right? Like,
Yeah.
or two, like, did you actually evaluate them and see? And most of them don't want it. Or if they do want it, they want it because they want to bring it up. Right. And so I think that to me is a red flag too, of like, they're just immediately saying like, go on a GLP-1. Well, what?
Or
Like,
any medication for I mean, there are obviously exceptions here, but throwing medications at things when lifestyle's not being addressed, right? Or like even at any kind of piss poor attempt. Like we're not saying that you need to fix all the things, but having some awareness and remembering when you went to medical school that the first line treatment for this shit was nutrition and exercise. I would really like to see that. And yeah, I've had clients who they're like they vehemently were like it was being shoved down their throat without being asked for it. The doctors were saying things like, "Are you sure? I really think you need it." Like bullying them, and I'm like
And I
if
feel
if you say no to a practitioner and they are
yeah, whoa,
not
red flag.
and they are not like I can understand a stance as a practitioner saying like, okay, let's talk about the risks and benefits of yes doing this or no not doing whatever said thing is. Like that's your responsibility as a practitioner. But to be shoving things down someone's throat because you don't believe in what they want, like that's not your job. That's like actually what you shouldn't be doing in that position. Like your personal beliefs, your religious beliefs, I don't care what, like political, like whatever it is that funnels into that, like you should not be putting that onto the person who is in front of you. And if someone is doing that to you, like run. That is an absolute no to me. Like I had women who were being told by like gynecologists that like they were sinning and like all of this stuff for, oh, I mean, I live in St. George, Utah.
Fair point.
You know, it just, and I think people would think that maybe I'm not. Like I had multiple women tell me that, and I'm not birth control's biggest fan either, but it's not my fucking job to tell someone what they should or shouldn't be doing with their life and their body. It's my job to educate you in the most non-biased way possible, which I know we're human. We all have biases, but doing your best to keep that awareness while you're talking to that person in front of you is so important. If you don't feel like your practitioner is doing that, like that is a disrespect and you should be running.
I agree. And
I feel very strongly about that.
I feel like there should not be shame or blame in the provider clinician or client relationship. You know, I think the same could go with like weight as well, right? Like I feel like there is a lot of fat phobia going on right now and a lot of weight bias, and your doctor or your provider, whoever they are, should be able to have a weight neutral talk with you. They should be able to meet you where you're at. And instead of, you know, shaming you for not working hard enough, they should be able to meet you where you're at and understand what you need, not blame you for why you're there.
Yeah, I mean, that's not going to help anybody get into a healthier position either.
No.
Like that's not supportive.
And I think it prevents a lot of people from getting help earlier because of that shame and blame cycle that happens, which is really unfortunate.
Yeah, so many people are afraid to go to the doctors.
For so many reasons, right? Like not just weight, like a lot of different things.
Yeah. Other red flags, ignore scope of practice. Is that where you're going to go?
No, but yes. And I feel like this goes not just for like your primary care. This goes for across the board, like, right, all the way to like health coaches and nutrition coaches. And I think something that I feel like we pride ourselves on, and this is why we, you know, became the collaborative, is that understanding that like you don't have to be the only provider for a client, and it takes a team, right? There's so many of us, and I think a good provider recognizes that and refers out.
Yes.
Sorry, I guess that's a green flag. But yeah, when they, you know, when your doctor is giving you a diet plan, like I see this all the time in my fertility crowd. And I'm like, does that fertility doctor have any nutrition education? And just like Danielle said, they usually have 0 to 2 hours. And once again, I think that should change. I agree. But also I think their education on when to refer out should change too. Like they should understand that like there probably should be a dietitian in most doctors' offices. There just aren't and probably won't be. But that's a huge red flag for me, is when they start giving diet advice, when your macro coaches are giving supplement advice. Like that's also outside of their scope.
I catch contraindications on nutrition coaches' pages all the time. And I'm like, and we are not like we think there's a space for everyone.
Yes.
You know, I do know a couple of health coaches with very advanced training. So different. But your basic macro coach who hasn't been through like
biochemistry,
I'm thinking of like Metabolic Mentor University, or Carrie's affiliated with it. With them, and she does like mentorship through them. Like, there are a couple that are like super advanced, and so, but your basic macro coach who hasn't done any advanced, who went and did PNL1 and they were a plumber beforehand,
that.
Yeah, like they just, I mean, the plumber, I don't know why I always pick the plumber thing for like people go from like plumber to like whatever.
Listen,
It's
shout out to plumbers. They really get the
dude,
job done when shit hits the fan. You know what I'm saying?
yeah, the proverbial. Anyway,
No shade on plumbers, by the way.
no,
You
like
guys are
that's
great. You do
not
your
the point.
job.
Are there any plumbers listening to this? But yeah,
If they are, that'd be amazing.
I really would encourage anyone listening here who gets a nutrition advice from a doctor, from a nurse practitioner, from a physician assistant, and they say you should eliminate bananas, protein hurts your kidneys, you should go keto, you should do intermittent fasting. My ask for you would be to say to them, can you tell me what education that you have received that makes you an authority on this topic that I should take your advice? There is nothing wrong with asking that question. And I think more people need to be putting these individuals in their place about that, because I would say 9.5 out of 10 of them are going to say, I'm an MD. Cool. You're not an RD. Did you say RD or MD? I'm confused. And at least for me, when people were asking me that, like I did have at least some other training about it, and I wasn't giving out like macro plans and telling people to eliminate things. I was basically just checking in on like, are you eating 3 meals a day with protein, fat, carb, and fiber? Like very basic
Also, if someone
things.
gives you an elimination diet, that is also a red flag.
Right.
Unless they're a dietitian and they have a long-term plan for you. I see
Yes.
this all the time with chiropractors, unfortunately. I
Yes.
see this with GI doctors, and sometimes primary care
The
physicians.
GI doctors who also say that nutrition has nothing to do with why your gut health is
Correct.
awful.
Correct.
But do
then
an
they put people,
elimination
but
diet.
do a low FODMAP diet. What? And I'll see you never. But an elimination diet, there is a time and a place for it, and
Yeah,
it should have a
totally.
start and an end date. And 9 times out of 10, when someone comes to me who has done an elimination diet, almost always unsuccessfully, because they were put on it and never told when to come off of it, so nobody can sustain that. That is a red flag.
Run.
And they're
Yeah.
always chiropractors. Sorry,
I
there's some
know.
great
I
chiropractors
know.
out there. It's not shade to them, but once again, that's not within their scope. And unfortunately,
Unless they have additional training.
correct. And that's where we ask, because some of
Yeah.
them are. And honestly, the good ones usually don't recommend elimination diets. So
Yeah. Any other big red flags before we
yes, kind of along that same line. So I feel like when you look more of the like functional side of things, I feel like, because I feel like unfortunately conventional and functional have kind of gone like almost polar opposites.
Yeah.
Is when they're pushing like endless testing, endless supplements, and not really taking into consideration, once again, the basics. I see this a lot in that more functional space of
Yeah.
let's just keep testing, right? And there's such thing as testing fatigue and supplement fatigue, right? People can
100%.
only do so much, and we have to think about the nervous system, and are they drinking water? Can they even do the things that you were talking about, right? Like of eating protein at every meal and going for a walk every day and getting 7 hours of sleep, right? Like when that's not taken into consideration, when it's just constant testing and supplements being pushed, certainly we are not anti-testing and supplement. They can do wonderful things. It's kind of having that discernment of like meeting the person where they're at. And I think that's something to ask too, of like, what does your testing process look like? How are supplements built into your recommendations? I think it's not a no, but if that's all they're doing and they keep saying more testing, more testing, more testing, and never actually focusing on foundations.
And I think for a clinician listening, one of the most important things that I think guides my practice is asking myself, what changes am I going to make based on the results? If the results aren't going to change the things that I do with that person, you probably don't need to be running that test. Yeah. And so if that's not a question that's guiding your testing and treatment plans with the people that you're working with, it needs to be. I would highly recommend that. So
agreed. I think the last thing that we've kind of touched on, but for me, is the kind of like we were talking about the vitamin D lab and not wanting to order it for the dietitian. It's that whole like being willing to collaborate. And I just see this all the time. Like I tell all of my clients, I'm like, I will happily talk to your doctor or provider and I will request the lab for you. I will get on a call with them. And 9 times out of 10, I understand most are busy and a lot of them just okay, whatever it is I'm asking. But if they're not willing to, if you are working with a dietitian or you're working with a PA or you're working with an FNP or whoever you're working with who's asking for something and your doctor immediately shuts it down, to me, that's a red flag. Like, why is there no, like they can hop on a call, they can get an email, like Yes. And it's the
I didn't think of
collaboration.
the idea, so it can't be right. I see
And
that so much.
me too. And it's so disheartening because at the end of the day, it's not about me. It's about my client. And I
Right.
wish that I think a lot of providers are nervous, right? Because people are on TikTok and Instagram and they're learning all the things. And I get that. But a good provider is not going to be threatened by that. A good provider is going to see the good in it, allowing people to take more control over their health and help guide them, in my opinion.
Yeah, I mean, when people bring things to me, I've had clients who told me things I'm like, I had no idea about that.
Me
You
too.
know, and I tell them that. I'm like, listen, I don't know everything and I didn't know this. So, like, I'm going to have to look into it or something like that, you know?
Some of my best advice has come from my clients, like learning and doing and implementing. And I think that's so cool. Like, it doesn't mean that I'm a bad provider because I didn't think of that.
We
Like,
can't know everything.
no,
My
absolutely
God.
not.
No,
My brain is only one cell big. So
it's actually a half cell because we share that one
that's
brain
right.
cell.
That's right.
So,
We've kind of mentioned a bunch of green flags, but do we want
yeah.
to kind of like,
Yeah.
give some
Yeah.
green flags?
So I have a list here of things that like I had put in a post. We've kind of touched on these, so I'm not going to like dive in deep and you can kind of interrupt me, but they ask about your lifestyle. They ask about your life because that matters, right? Like all of the basics. Controversial, but they lead a healthy lifestyle themselves. Like
Mm,
this is really important to me. And you know, I'm actually doing a free webinar through my business, like an optimal health lab tour about things that I've done on myself. And I've had some stuff come back that, you know, my hormones are on the lower end right now because I've been through a lot of stress and my fucking LP little a that I can't do anything about because it's genetic is super high. You know, my labs don't look perfect, but I walk the walk that I ask my people to do. And I always tell my people, listen, like I am not some guru on a hill somewhere. I'm in the trenches with you. I just happen to know a lot of stuff.
And there's a difference, right? I think I know there can be some like shame in the practitioner community of like, I know when I like had my miscarriage, for instance, there was a lot of shame because I work with fertility clients and that doesn't mean like we're humans. We're humans
Yeah.
still being
Yeah.
humans. There's a difference between that versus not living a healthy
And like
lifestyle, right?
complete neglect, right? Like you come
Yes.
in the morning, you didn't eat breakfast, you have a Mountain Dew or a Celsius in your hand.
There's the cardiologist going out for a smoke break at my old
Yeah. I mean,
hospital. Like
like really
there's a
obvious
difference.
things like that. Like,
Yes.
does your, and this kind of goes along with another post I did about things that you can ask when you schedule to find a PCP too, which, you know, if I know that there are people who are listening who are not clinicians that have told me they've been enjoying the podcast, ask the front desk who leads a healthy lifestyle and who's really into like more, you know, functional or alternative medicine, or they do a blend or something. Like people who
I
ask that
also
got put
Google.
right on my schedule.
I Google and see, like, usually they have some bio somewhere that'll say, like, enjoys hiking with the family or go
Yeah.
skiing or, like,
Yeah.
I don't know, someone who lives a more
Loves
active lifestyle.
nature,
Yeah. Like
meditates,
cooking,
whatever.
bake, whatever. Yes. Like, I feel like you can, now that we have this information, you can do some digging.
Yeah. When labs come back normal, they want to keep digging, right? So they don't just say, everything looks normal. See you in a year. Try not to have a mental health crisis or get fat. Bye.
Mental health crisis. I mean,
Listen, I
that's
had one of
affect all
those
of
over the
us.
weekend. Like, it's fine.
And something for me that I wrote down that I think we have in our list anyway is like a partnership over a dictatorship. Like,
Yes.
just because, like, for instance, I'm your provider does not mean that I am the end all be all. I'm here to guide you and to educate you and to give my suggestions, but we are a partnership. And I want you to come back to me and say, this isn't working. This doesn't feel good, or this wasn't right. Or, you said to do this, but now this is happening. I'm getting heartburn. Like, this is a partnership. And that's how it should feel. It should not feel like, it's my way or the highway as a practitioner. Like, absolutely not. So you find someone who you feel like you're in partnership with, that's what we want. They don't have to be you don't have to know everything to be a good provider, but they do need to be able to have that partnership with you. And that's where I hate like this, when people say evidence-based, and everyone thinks evidence-based is only based on research.
It's not.
It's not. It's based on client experience. It's based on research. And what's the third one?
I can't remember.
I can't remember either. I'm going to pull it up because I think that's
It's three
important too.
things. And I remember we've talked about this before.
Yes.
And I always say to people, I'm a facilitator in your health, not a dictator. I've long said that. Like, I mean, I think ever since I got my license, I said that to people. I felt very strongly about it. And I think a lot of the times people do
Oh,
forget that, you know, when you've seen 10,000 people, the patterns start to get ingrained in your head. And they, you know, I heard somebody talking about this, and I always use this example. I was just fucking telling somebody this the other day. But you, like, radiologists will start to make calls on films and on CTs and MRIs that they can't tell you why, because they've just seen so many that
that's
they
cool.
know. And that
That's the
matters.
third part. So it's patient values, goals, and preferences,
Oh,
research evidence, and the third one is clinical experience.
yes, that matters.
It does. And it does,
And
it's
then when
not
these
always
people come
following
at
the
you and
textbook.
in the fucking comments, I need a PubMed ID for this. Listen, PubMed ID, my fucking 10,000 people that I've dealt with this. That's your PubMed ID, like,
Yeah.
here. I feel I get so mad at the people who, I mean, I get so mad about it, and I also understand it at the same time. Like, also, you can go do a PubMed search on your own. I just, that really grinds my gears, because between you and I, we have over 25 years of experience in health, medicine, wellness, strength training. Like, we have a lot of education between the two of us. And especially if you start to look at the advanced training certs that we've done. And so it becomes very frustrating when, just because you don't agree with my views doesn't mean that I haven't seen these things, and that I haven't learned these things through working over thousands and thousands of hours and thousands of thousands of people.
Yeah. Like for instance, I feel like we've both got crap for was like us saying that they're handing out GLP-1s like they're candy and people get
They
really
are.
mad. And it's like, but we're seeing this, like boots on the
Yeah.
ground. We are seeing this. And it's not saying we are anti the use of
Yeah.
GLP-1s. We are just anti them giving it out willy-nilly to every other person. And I think that's the other green flag for providers is like foundations over quick fixes,
Amen.
like the basics over biohacking of like, if that person is going to spend most of their time on the basics and foundation, it might seem boring, but I promise you it's going to give you more long-term results than just these quick fixes and, whatever cleanses and supplements and whatever.
Yeah, I agree 100%. And are there any more green lights? Because I have some questions for people to ask that I think would be helpful, really, for anybody. But
I
um,
feel like we've said most of them. I mean, it's kind of like the opposite, right? Of like a more nuanced approach, transparent about their scope and knowing when it ends and when to refer, open to that collaboration, right? They're willing to send you elsewhere, even if that means losing you. Like I've had
this is
clients,
such a big one for me.
yeah, like I send clients to therapists and I say, you need to go to therapy.
This
When
is more
you
important right now.
work through that, if you still want to come back to me, great. But like that's where you need to spend your time and money.
Yeah. I did a consult one time with a guy who, he needed like an eating disorder dietitian more than he needed me. And he's referred people to me, and I did not work with him.
Yeah, I
So
mean,
doing the
that's
right
happened to
thing
me too.
matters.
Yes. Because people like don't care what you know until they, care what you know until they know that you care, right? And so it's like
That hurt my brain. I understood it, but it took like way
it
too
took me it
long.
took my brain a while too. But I think that's part of it too, is that like I there's plenty of people in my inbox that I will say no, like we're not a good fit and here's 5 people to contact. Because I also don't love leaving people to the abyss because
Yeah, I totally like sent them, other people's
yeah.
information.
But that's where that collaboration of like, and that does the collaboration doesn't always mean that they're sending you elsewhere, right? It could
Yeah,
just mean that like a pelvic floor PT referral, so that when you have constipation or leakage that's impacting our work
yeah,
gets help, right? Like, and or
totally.
getting on the phone with a provider. Like I'm always happy to talk to somebody. I don't care. Like we have the same end
They're
goal,
not
which is to
always
help the
happy to talk
client.
to us.
No, they often
Yeah.
deny me. But I think we've met, I mean, I don't know if you have any
Yeah.
more, but I think we've mentioned most of the green flags, especially when we were talking about the red flags.
I would like to read these questions off, because I
Yeah.
do think that even for practitioners, it can be hard to find somebody good. So let me just say that the front office knows, like, they know who their providers are. They're like, any front office person that worked with me knew that I was hella fucking into movement, nutrition, taking care of my body, hormone replacement therapy. They all knew. And especially if the medical assistants definitely all knew.
Well,
Um,
and know that you like advocated for your
yeah,
patients
yeah,
as well,
yeah,
right? Like I think that's big. Like you've always done that ever since I've known you. And I think
yeah,
I bet a MA or a office administrator would know that too.
100%. So, is there a practitioner in your practice that strength trains?
Oh,
Great question.
love
That tells
that.
me a lot about a person. It tells me that they're disciplined. It tells me they care about their health. It tells me they understand on a personal level taking care of their body, right?
They're not going to tell you to stop moving. One, my husband no
Yeah.
longer goes to them, but my one person long time ago told my husband, this was when he was like, I don't know, 28, told him that he should really just walk and swim. And my husband was like, I no, what?
Hmm. Get fucked.
Yeah.
Next.
He left. Like,
Do any
what?
do any of your practitioners live a really healthy lifestyle? Do any of your practitioners have any functional medicine training?
They have no idea what you're talking about, but you have your answer.
Yeah, exactly. Do you have any practitioners who try and minimize medications for their patients?
Ooh, that's a good one.
I thought so too. Do you have any practitioners who also value holistic medicine? Those are the ones that I have listed out. And I just think that like if anyone's able to answer one of those questions for you, because they may not know all of them, but I think if they can answer one of them, even it can give you some ideas. And then, like you said, doing some screening. I mean, listen, I will find out who you divorced and what the name of your firstborn child
Me
is
too.
on the
I will
internet. So
And I also think, I will say it is hard to find providers, especially like
yes.
in the conventional world, who have availability within the next month or so. So this might be a process. So just stick with it. Also, I think just asking other people in your community, like I ask all the time with my clients, if they say something that's a green flag, I'm like, give me their name immediately. And now I just have a
Yeah.
list going of people in my community because I'm like, if it doesn't take a lot to get a green flag these days, but like
So sad.
it is sad, but there's not many of them. And so when I hear them, I'm like, okay, yep, you're getting referrals because we need more of them.
Yeah. Finishing thoughts?
I think that was a lot. So
We did this was a longer episode.
sorry.
So hope you guys enjoyed all of our clinical spiraling
God, I
responsibly.
feel like we could talk about that forever. Whoa.
We really could. So what are we talking about next week?
It's a great question.
Do we know yet?
I don't
Oh. Feel first why undereating is wrecking your client's hormones and metabolism.
know.
Stay tuned. And we'll see you next week.
Bye.
Bye.